afternoon. My name is Lauren. How are you?
Good, and you?
Good. I'm going to be your nurse today. So can you just tell me your first and last name, please?
Nicole Soto.
Okay, and what is your date of birth, Miss Soto?
6/5/96.
Okay, great. And do you have any allergies?
No.
No? Okay, and how are you feeling today?
I'm feeling good. I just have a little headache.
Oh, you have a headache?
Yes.
Okay. Where's your pain located in your head?
Like here, it kind of like both sides.
Okay, and what kind of pain is it? Is it a dull, an ache?
It's kind of dull.
Okay, and on a scale of 0 to 10, what level is your pain? 0 being no pain, 10 being the worst?
Like a 6.
Okay, and is there anything that makes your pain better?
If I stay in quiet places, like in my room, away from noise,
Okay, and is there anything that makes the pain worse?
loud noises.
Okay, and is there anything you do to treat the pain? Do you take any
I
medication?
take some Tylenol.
You take Tylenol? Okay, great. So I just have a few questions for you, okay? Do you know where you are?
Yes, I'm in the hospital.
Okay, and do you know what today's date is?
July 30th, 2018.
Yep, that's correct. And do you know who the president is?
Trump.
Okay, great. So you're alert and oriented ×4, so that's excellent. So I saw the PCA came in and she did your vitals already and everything was within normal range, okay? So I just need to do a physical assessment. Is that okay with you?
Yes.
Okay. Okay. So I'm going to begin by assessing your head. So by looking at your face, your skin color is appropriate for your race. I don't see any drooping. Face is symmetrical, so that's excellent, okay? So I'm going to feel your scalp. Okay. No bumps, bruises, lesions. Scalp isn't dry. Okay, so now I'm going to assess your ears using my pen light. Okay, no drainage, no redness, no swelling. Okay, can you go ahead and open your mouth for me, please? Okay, so gums are pink, moist, and intact. Tongue is pink, moist, and intact, so that's great. Okay, can you turn your head that way for me? Okay, so I'm assessing your for jugular vein distension. Okay, so no jugular vein distension. Okay, I'm just going to check your carotid pulse. Okay, great. Okay, no pulse deficits, so that's excellent. Okay, so I'm going to check your lymph nodes. Okay, occipital, postauricular, preauricular, submental, or submandibular, submental, superficial cervical, deep cervical, and supraclavicular. Were any of those tender or painful when I touched them?
No.
No? Okay, so that's great. So non-tender, non-palpable lymph nodes. So now I'm going to assess your carotid for bruits. So I'm just going to have you turn your head that way for me. Okay. Okay, excellent. So no bruits present. So I'm just going to check your cranial nerves, okay? So if you could come sit on the edge of the bed for me here. Okay, so I want you to let me know, can you smell what this is?
Coffee.
Coffee, that's correct. Okay, so cranial nerve 1 is intact. The PCA already came in and she did your Snellen chart. So cranial nerve 2 is intact and that was all within normal limits, okay? So now I'm going to have you follow my pen light. Okay. And now I want you to look straight at me, okay? Okay, great. So your pupils are equal, round, and reactive to light, and cranial nerves 3, 4, and 6 are intact. So now I'm going to check cranial nerve number 5. So I want you to close your eyes and let me know when you feel this. Okay.
Yes. Yes. Yes.
Okay, great. So now I'm going to check cranial nerve number 7. Can you clench your jaw for me? Okay, can you smile, frown, and lift your eyebrows? Excellent. Okay, so cranial nerve 7 is intact. I want you to let me know. Can you hear this?
Yes.
Okay, and can you stand up for me? Okay, just with your feet together and go ahead and close your eyes. Okay, great. That's a negative Romberg test, so go ahead and have a seat, and cranial nerve 8 is intact. Oh, so you can stay on the edge of the bed here. Okay, so now I'm going to check cranial nerve 9 and 10, so can you stick your tongue out for me? Okay, move it side to side. Okay, and can you swallow? Okay, great. Cranial nerve 9 and 10 are intact. Now I'm going to have you raise your shoulders. Okay, excellent. And can you stand up again for me? Okay, so I'm going to have you walk towards me. Okay, and walk back the other way. Okay, so good gait and balance. That's excellent. Okay, and can you do rapid motion with your fingers as fast as you can, finger to thumb? Excellent. Okay. Now I'm going to have you lay back in the bed. Okay. And can you take the heel of this foot up to up the shin of this foot and back down? Okay, and with the other foot. Okay, excellent. Thank you. Okay, so now I'm going to assess your chest. Okay, so good chest expansion, good symmetry. Rate and rhythm are even and expected. Okay, no distress noted. Okay, color. Okay, good color. No lesions, scars. Okay, I'm going to listen to your lung sounds now, okay? So can you lean forward for me? Okay, take a deep breath. Okay, now I'm going to listen to the front. Okay. Louder. Okay, no abnormal lung sounds noted, so that's great, okay? So now I'm going to go ahead and I'm just going to listen to your heart sounds, okay? Okay. Aortic, S2 greater than S1. Pulmonic, S2 greater than S1. Herbs using my bell, S1 equals S2. Tricuspid, S1 greater than S2. And apical, S1 greater than S2. Now can you just lean forward for me? I'm going to assess your apical pulse for 1 full minute. Okay, apical pulse is 80, so that's great, okay? Okay, so now can you just put your arms out for me? Okay, I'm going to have you push up on my hands, okay, and push down, okay? And I want to check your range of motion, so just cross your shoulders, here, okay? And back behind, okay, back behind, okay? And good range of motion and good strength, okay, as expected. So now I'm going to check the warmth of your arms, okay? So they're warm and dry to touch. That's great. And I'm going to check your capillary refill. Okay, brisk capillary refill, so that's excellent, okay? So I'm going to go on and do my abdominal assessment now, so I'm going to lay you flat, okay? Okay, so I'm just going to expose your stomach here. Okay, so I'm going to begin by inspecting. Okay, no distension, color as expected, no scars, lesions, no drainage. Okay, so I'm going to begin by auscultating in the right lower quadrant. I want you to let me know if at any point during this you feel pain, okay? Okay, so your bowel sounds are active. Can you tell me when was your last bowel movement?
This morning.
It was this morning? Okay. And what was the color and consistency of that bowel movement?
It was solid and warm, and it was
Okay.
brown.
And what about urination? Do you have any frequency, hesitancy, pain when you're
No.
urinating? No abnormal odor?
Mm-mm.
Okay. So now I'm just going to go ahead and percuss your abdomen, okay?
Mhm.
Let me know if you feel any pain.
Mhm.
Now I'm going to palpate lightly. Okay, and no pain? Okay. I just need to auscultate real quick for bruise, okay? Using the bell of my stethoscope. Okay, no bruise present. So now I'm going to go on to do my assessment of your legs. Okay.
Sorry.
It's okay. I'm going to begin by checking your patellar pulses. Okay, both patellar pulses present. And your pedal pulses. Pulses bilaterally present. I'm going to check the warmth of your legs. Okay, legs are warm and dry to touch. I'm going to check for pitting and edema. Okay, no edema present. I'm going to check for tenting. Okay, no tenting present, so no dehydration. Okay, hair is evenly distributed. Okay, can you extend your leg to the side for me? Okay, cross it over. Okay, and bring it towards you. Okay, and same with the other leg. Excellent, okay. And can you push down on my legs? Okay, how about? Perfect. Okay, great. Let me just check for tenting on your hands real quick. Okay, no tenting present anywhere. So that's an excellent assessment, okay? Do you have any questions for me? No?
I just don't have anything.
Okay, I'll let the doctor know about your headache, okay? And we'll see what we can get for you, okay? You have an excellent day.
Thank you.